Cancer is also called malignancy, and it is an abnormal growth of cells. There are more than 100 types of cancer, including breast cancer, skin cancer, lung cancer, colon cancer, prostate cancer, and lymphoma. Depending on the type and stage of cancer, treatments to tumors to slow its growth may include some combination of surgery, radiation therapy, chemotherapy, hormone therapy, or immunotherapy. Surgery can be used to diagnose a cancer, treat, or even prevent cancer in some cases. Most people with cancer have some type of surgery. It's not always the cure for the cancer, but it helps to not spread to the other parts of the body. Chemotherapy. Chemo is the use of medicines or drugs to treat cancer. The thought of having chemotherapy frightens many people. But knowing what chemotherapy is, how it works, and what to expect can often help calm your fears. It can also give you a better sense of control over your cancer treatment. Radiation therapy uses high-energy particles or waves to destroy or damage cancer cells. It is one of the most common treatments for cancer, either by itself or along with other forms of treatment. Targeted therapy is a newer type of cancer treatment that uses drugs or other substances to more precisely identify and attack cancer cells, usually while doing little damage to normal cells. Targeted therapy is a growing part of many cancer treatment regimens. Immunotherapy is treatment that uses your body's own immune system to help fight cancer. Get information about the different types of immunotherapy and the types of cancer they are used to treat. Hyperthermia. The idea of using heat to treat cancer has been around for some time, but early attempts had mixed results. Today, newer tools allow more precise delivery of heat, and hyperthermia is being studied for use against many types of cancer. A stem cell transplant gives a patient new stem cells. The new stem cells can make new, healthy blood cells. Autologous transplant. Doctors call this an autotransplant. This type of stem cell transplant may also be called high-dose chemotherapy with autologous stem cell rescue. Allogeneic transplantation. Doctors call this an allotransplant. In an allotransplant, it needs to get another person's stem cells that match from the patient's bone marrow to have certain proteins on patient's white blood cells called human leukocyte antigens. Photodynamic therapy or PDT is a treatment that uses special drugs, called photosensitizing agents, along with light to kill cancer cells. The drugs only work after they have been activated or turned on by certain kinds of light. Lasers in cancer treatment, which are very powerful, precise beams of light, can be used instead of blades, scalpels, for very careful surgical work, including treating some cancers. Many human proteins produced in recombinant form are difficult to manufacture, and some cannot be expressed at all in microbial cell culture. Furthermore, the serum half-life and tissue distribution of endogenously expressed proteins is carefully controlled in vivo to optimize their biological activity. Most human proteins are not designed to be administered from outside the body. Recombinant proteins therefore tend to be rapidly cleared and thus require frequent injection. Monoclonal antibodies, MAB or MOAB, are monospecific antibodies that are made by identical immune cells that are all clones of a unique parent cell, in contrast to polyclonal antibodies which are made from the several different immune cells. It is possible to produce monoclonal antibodies that specifically bind to that substance. They can then serve to detect or purify that substance. This has become an important tool in biochemistry, molecular biology and medicine.